So we're going to talk today about why pandemics are a team sport and some of the data that backs that up. I was going to try and find a really gung-ho team movie, but this is actually one of my favorite comedies, and I thought that the farcical nature of this movie probably matches better the farcical team dynamics of what we're doing in the US, particularly with the events of the last 24 hours where now we're not wearing masks on public transportation anymore. So probably a more appropriate movie to highlight how we've been handling the pandemic. The first thing to talk about is a couple of studies that just highlight, again, the importance of vaccination and the importance of vaccination more potentially on the individual risk level, where people obviously are tending to focus a lot more. But there's been a number of analyses of the recent epidemic wave of BA2 in Hong Kong, which was quite severe. This just came out in preprint from a very, very good group in Hong Kong, actually some of the best respiratory virus specialists in the world, analyzing the data across the multiple waves of infection that have occurred in Hong Kong. And you can see there were 4 previous waves of COVID-19 in Hong Kong. And I think if you look at the scale, that's kind of illustrative of how severe this most recent BA2 wave was. For those previous waves, wave 1 through 4, that scale goes up to a max of 200. And you can see only a couple of times did they hit 150 cases a day in Hong Kong prior to the BA2 wave. If you look down at the bottom left panel, that's the BA2 wave. That scale goes up to 80,000. And so they had many days where they exceeded 50,000 cases in a day. So the magnitude of the BA2 wave compared to anything else in Hong Kong, obviously, dramatically different. And that goes for deaths as well. And you can see they only had a handful of deaths on any given day in the previous waves, and they exceeded 250 deaths a day for a long stretch of time in March with the BA2 wave. And obviously we talked a bit about how severe the Hong Kong wave and how explosive it was. You can see that doubling time of 3.1 days is quite impressive in terms of that epidemic. There's a lot of good data in this paper. I won't go over all of it, but I think the one thing I want to talk about is the effect they found on vaccination. And so I think 2 things to take, well, maybe 3 things to take away. First of all, if you look at the comparison of the case fatality rate among people in the first 4 waves and the case fatality rate in wave 5 for somebody who did not have a complete vaccination series, that just means 2 doses, not even a booster. You can see that those are relatively similar. So this idea that Omicron and BA2 are so much milder in terms of disease, I think really only reflects the level of immunity and vaccination in a population. In this group, which is essentially relatively naive, or at least not fully immunized, you can see that across all of the age groups, for the 5th wave, case fatality rate was similar for BA2 compared to previous waves. Only in people who were vaccinated with a full primary series did you get significant reduction in mortality. And you can see that's across the board, even in middle-aged folks, age 45 to 64, even though the CFR is obviously much lower, there's still a significant difference in people who got a primary series completed. And you can see that that's more pronounced and exaggerated in folks who are over the age of 65 and particularly over the age of 80. And because that low percentage of folks in those age groups that had completed a primary series and had a booster, and that was one of the reasons why Hong Kong had such a high rate of hospitalization and mortality, and we've talked about that. So I think takeaways here, BA2 is not necessarily more benign when you have a population that has, or in a person who's not immune or doesn't have at least some level of immunity, and the effect of vaccine is pretty pronounced across all age groups. These are data from Singapore, looking at their recent experience in the Delta and Omicron waves. And you can see really looking for essentially the past year from the beginning of last May. And they see similar results where in non-fully vaccinated persons, the case fatality rate is quite high, especially when you get into people over the age of 60, but it is significantly reduced in people who've been vaccinated and even more reduced in people who've received a booster. So you can see that roughly 25 to 30 times lower case fatality rate in people over the age of 80 who'd been boosted compared to those who were not fully vaccinated. And full vaccination with a booster, even if you're in your 70s, gets you back down to the relative risk of somebody in their late 30s or around 40 who is not fully vaccinated. So vaccine provides a huge amount of protection across all of these age groups in reducing the risk of death in those groups. Now we're seeing this in the US as well. This was a recent publication that just came out in MMWR, looking at the effectiveness of mRNA vaccination in preventing hospitalization. Now, the twist in this, and why I think this is important, is this was specifically looking at people who had had a previous diagnosis of SARS-CoV-2. So again, looking at those folks who say, well, natural immunity is best and the vaccine can't help me anymore if I've already had an infection. Well, the data clearly don't bear that out and show that that is a false assumption. And so if you look at the vaccine effectiveness for folks who had a previous infection and were vaccinated and then potentially boosted, you can see that they have a dramatic risk reduction in hospitalization compared to those who were prior infection, but no vaccination. So even just one dose of the vaccine, you can see provides around 40% protection. And whether it's one dose or two doses doesn't seem to necessarily make a huge difference there. And it's probably just related to the duration of time, in part, that's expired since or transpired since you got that dose. But also look at the effect of getting a booster. You dramatically increase the protection. So people who were boosted had essentially a 2/3 reduction in risk compared to those who'd just been previously infected but had not received any vaccine. And so again, just points out, and this was true whether it was the Delta predominant period or the Omicron predominant period, there seemed to be good protection against both. So again, pushing back on that myth that natural infection and natural immunity is the best way to go. Certainly that helps, but the best way to be protected is to get vaccinated as well and to be up to date on your vaccines. Now the last study to talk about, and this is where we'll get into the team dynamics. But first, I think important to look at the overall data here. And again, just bearing out that protection on an individual basis as well. So this was a study that was published in the New England Journal just a couple of days ago. This came out of a large, healthcare insurance provider in Israel, looking at 180,000 matched pairs. So people who were 60 and older in Israel in January and February of this year who were eligible for the fourth dose. And so they took 182,000 who got their fourth dose and compared them to 182,000 who didn't get a fourth dose. So they only had 3 doses of the mRNA vaccine. And they looked at 5 outcomes, whether you had a diagnosis of COVID by PCR, whether you had symptomatic COVID infection diagnosed by PCR as well, whether you were in the hospital because of COVID, whether you had a severe COVID infection in the hospital, and that had to do with, requiring more oxygen, ending up in the ICU, et cetera, and then whether you died from COVID. And what they saw across the board is dramatic reduction in all of those outcomes in people who had been boosted compared to those who had only had 3 doses. So you can see, starting in the top left panel, that is just all SARS confirmation by PCR. And you can see that over time, those curves continue to diverge. And the people who had a fourth dose were much less likely as time went on to be diagnosed with any COVID infection by PCR. In panel B, that's folks who had symptomatic disease, and you can see that the difference is even greater. C is hospitalization, and the difference is greater compared to certainly primary or just diagnosis with laboratory confirmed infection. And then D is severe disease, where you can see an even greater difference. And so if you look at the kind of what those numbers equal, it's about a 2-fold reduction in all infections diagnosed by PCR, about 2.5-fold reduction for symptomatic COVID, about 3 to 3.5-fold reduction in hospitalization and severe cases, and a 4-fold reduction in death. You can see here over the course of the study. So showing that a fourth dose, at least in obviously this was a relatively short period of time that they were able to study, provided significant protection for the individual against those severe outcomes. And if you look at the vaccine effectiveness just for infection, you can see that it's about a 50% vaccine effectiveness, so 50% reduction in relative risk, and that stays consistent between about day 10 through day 30. There does not seem to be degradation during that period of time, and we will obviously have to see how long that would last, but one can expect, based on previous data from previous doses, that it certainly won't last forever, and that protection against infection will start to wane after a couple of months, and protection against hospitalization and severe infection will probably wane a bit after that. But by 4 to 6 months, we'll start to see reductions again. But at least in the short term, certainly that is a significant reduction, again, not only in death and hospitalization, but even in infection. And that makes a big difference. If you think about it, a 50% vaccine effectiveness or 50% reduction in risk of infection is essentially the mathematical equivalent of cutting the effective reproduction number in half, if that applies across the entire population. And remember, we talked about this when we did the little thought experiment in the quack virus. It's all about exponential growth, right? So there's been this, I think, predominant narrative across the media that, well, maybe additional doses of vaccine can provide some protection against hospitalization. So maybe that's important for older people because they have higher rates of hospitalization. But the extra doses of vaccine don't really prevent infection and spread. And so they're not really important for anybody else. And they're not important on a population basis. And that's just not true, right? Because it's all about exponential growth. And so remember, every time there's a new generation of cases, as it's transmitted from one person to the next, you have exponential growth depending on the R value. Depends on, that dictates what the exponent is. But over multiple generations of cases, that translates into huge numbers. So remember, we did this thought experiment with a virus that has an R naught of 4, or an effective reproductive number of 4 at the given time. And so you would expect 4 people from every case in each subsequent generation. Now, if you cut the effective reproduction number in half by making 50% of the population immune, you essentially take that half of the population off the table as potential susceptibles, and you cut the reproduction number in half. So if you carry that out for a virus that has an R naught of 4 over 10 generations of cases, and you cut the reproduction number in half based on vaccination or some other intervention, you can see that at 10 generations of cases, the difference is huge. So in generation 10, with an R value of 4, you'd expect 262,000 cases, but with an R value of 2, you only expect 512 to be generated at that time. So you can see a dramatic difference in the number of total cases you're going to get just by cutting that R value in 2. So even if vaccination boosting only gives us a 50% reduction in the effective reproduction number, that's a huge impact, especially if you have a large epidemic wave that's occurring or coming. And so it's untrue to say that a vaccine has no effect on potential transmission across the population. Boosting can have a huge impact even now. And that's why it's so important to remember that pandemics are a team sport. It is the cumulative and synergistic effect of all of these different actions we're taking: additional doses of vaccine to reduce the likelihood of being infected, wearing face masks in situations where transmission is more likely, continuing to do steps of social distancing, and all the things we know can modestly reduce the transmission. When you layer those modest reductions on top of each other, they can have huge exponential impact as you get down the road. Unfortunately, we're not doing any of these things, right? We're not vaccinating, we're not boosting at any significant rate. Our boosting rate rate is among the lowest of any industrialized country now, and we're not adding additional boosting. Our daily rate of vaccination is as low as it's been, and we're taking away non-pharmaceutical interventions rather than adding them, as the BA2 wave is starting to surge, certainly in most parts of the eastern US and potentially across the rest of the country. Where that BA2 wave is going to end up, I don't think it's very easy to predict at this point. To be honest, if we don't get a really large wave now in the next month, which I think is a coin flip at this point, I think there's different factors working against each other. I think we'll see a repeat of last year where we'll get a very large surge starting in the south in June, July timeframe, and that will hit us probably more severely in the fall. And if we don't get that additional natural boosting of a BA2 wave soon, that just means our summer and fall wave will be even worse, and probably worse than the waves that we experienced this past year, because our vaccines are going to be so far out for most people from their last dose. Our relative level of population immunity is going to be very low. So again, pandemics are a team sport, and this, make a decision, that's best for you stuff is just complete bunk, and it's going to get us right back into where we were last fall and probably worse. That's all I got.